Hi, good morning, Alan. My name is Mihiraa. I'm your invigilator for the OET speaking session on the 5th of February 2024. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Alan Dever.
All right, Alan, could you please confirm your candidate number?
Yes. My candidate number is 432133428.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
How do you handle conflicts or disagreements within the healthcare team?
I believe open communication is essential in resolving conflicts. If a disagreement arises, I prefer addressing it promptly and professionally. I would initiate a respectful conversation with the involved parties, aiming to understand different perspectives. Collaborative problem-solving and finding common ground are crucial for maintaining a positive and effective healthcare team.
How do you prioritize and manage your workload in a busy healthcare environment?
Prioritizing tasks is a skill I've honed throughout my nursing career. I start by assessing the urgency and importance of each task, ensuring that critical patient needs are met first. I am comfortable delegating tasks when appropriate, and am adept at organizing my time efficiently. This approach allows me to handle a demanding workload while maintaining a high standard of patient care.
Can you share an experience where you demonstrated exceptional teamwork?
Teamwork is integral to delivering quality patient care. At a challenging situation at my previous workplace, we had an unexpected surge in patients. I collaborated seamlessly with my colleagues, dividing responsibilities based on our strengths and expertise. By working cohesively, we managed to provide timely and effective care, showcasing the power of teamwork and delivering positive outcomes for patients.
How do you ensure cultural competence in your nursing practice?
Cultural competence is crucial in providing patient-centered care. I am committed to understanding and respecting diverse cultural backgrounds. I actively seek to educate myself about various cultures, traditions, and healthcare beliefs. This knowledge allows me to adapt my communication and care approach, ensuring that each patient receives culturally sensitive and appropriate treatment.
Can you provide an example of a challenging patient interaction and how you handled it?
In a previous role, I encountered a distressed patient who was frustrated with their treatment plan. I actively listened to their concerns, empathized with their feelings, and involved them in the decision-making process. By addressing their worries and collaborating on a revised care plan, we were able to improve the patient's experience and satisfaction. It reinforced my belief in the importance of effective communication and patient-centered care.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Good morning, Mihiraa. My name is Nurse Alan Dever, and I'm here to do your clinical observations today. How are you feeling?
Thank you for coming, nurse. I'm all right, I guess. No pain at the moment, and no nausea either. But something's been on my mind, though I wonder if I should ask.
Please do, don't hesitate, Mihiraa. All questions are valid, and we're here to help. What's bothering you?
It's about when I first came in here, 2 days ago. My leg was in really bad shape, almost lost it, you know. But the nurse took my temperature and stuff, before even looking at my leg. Why was that? Shouldn't she have checked my leg first?
Absolutely, Mihiraa. I completely understand why you might be curious about the order of assessments. Your concern is valid, and I appreciate you bringing it up. The decision to prioritize checking your vital signs before directly addressing your leg injury is based on a well-established standard procedure for trauma patients. This protocol is carefully designed to swiftly identify and address any potential immediate threats to your life. By assessing vital signs first, we can quickly identify issues of critical aspects that, if not addressed promptly, could pose serious risk to your overall well-being. So, in essence, the nurse took your vital signs first, as part of a systematic approach to prioritize and address the most urgent concerns to ensure your safety.
I see, but my leg was in danger of being amputated, and I thought that should have been the priority.
I empathize with your perspective, Mihiraa. Indeed, the severity of your injury is not overlooked. However, our approach to assessing trauma patients involves a systematic procedure known as the primary survey. This primary survey is crucial in checking for critical issues that could pose immediate threats to your life. We focus on aspects such as airway problems, breathing difficulties, and severe bleeding, elements that could swiftly become fatal if not addressed promptly. Once we ensure stability in these critical areas during the primary survey, we then transition to the secondary survey. This phase allows us to thoroughly assess other injuries, such as the one in your leg. The overarching goal is to prioritize overall patient safety by methodically addressing potential life-threatening concerns before moving on to a comprehensive evaluation of other injuries.
All right, but I felt quite alert, though, and I believe I could have communicated if there was something seriously wrong. I don't think I was in immediate danger of losing my life.
I appreciate your awareness, and it's great that you felt alert, Mihiraa. In trauma situations, while you might have felt alert, the body sometimes masks serious injuries, especially under the influence of adrenaline. Our experienced staff follows clear procedures to ensure a thorough assessment. The primary survey helps us identify any hidden dangers that might not be apparent to you or even us at first. Not following this established procedure could have delayed critical interventions and potentially put your life at risk.
Okay, I understand now. It makes sense.
Great. I'm glad we could clarify that. Are you okay now, if I proceed with the clinical observations?
Yeah, go ahead. I apologize for being upset earlier.
No worries at all, Mihiraa. That's what we're here for. Well, before concluding, let me summarize what we have discussed so far. You came in 2 days ago with a severe leg injury, and you were concerned about the order of assessments performed. Specifically, you wondered why we took your vital signs before addressing your injured leg. I explained that our standard procedure involves a primary survey to identify immediate life-threatening issues, followed by a secondary survey to assess other injuries. This protocol helps ensure overall patient safety and allows us to prioritize critical interventions. Despite your feeling alert, trauma situations can mask serious injuries, and our experienced staff follows these procedures for a thorough assessment. Now, if you're comfortable, can we proceed with the clinical observations?
Sure, you may please. And thank you for your detailed explanation.
Your well-being is our top priority, Mihiraa, and we want to make sure we provide the best care possible. If you have any more questions or concerns during the observations, feel free to let me know. We're here to support you throughout your recovery. I wish you a speedy recovery.
Thank you so much for your time. That is the end of your OET speaking role play. All the best.
Thank you, Mihiraa.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.